Hi, I'm Dr. Sam Lamb. I'm the chair for the ISHRS Berlin meeting coming up in October. I'm here with Konstantinos and Anastassakis, as well as Akaki Tsilosani, and they are masters of FUE and FUT. This is a masterclass which will really focus on a very granular deep dive of how these masters combine the art of using both FUE and FUT simultaneously. So we're going to hear some of the pearls that they've got, and it's going to be a little bit of a tease for the main session on this master class. So I'm going to start with Akaki. Akaki, can you tell me a little bit of when do you combine FUE and FUT in a patient?
Good morning, dear Sam. Hello, Konstantinos. So modern technique of hair transplant today are close to perfection and really gives us excellent result. Main problem limiting our results is poor donor supply of a particular patient. So combination of FUT and FUE is like parachute. It gives us chance to maximize donor supply when we need big number of follicle units, thousands and thousands of follicle units, when we have to restore high classes of androgenic alopecia, and when patient wants to do it in one session. So with FUT, if you do giga session, we have to increase the size of the strip to obtain needful amount of grafts, and big width of the strip increases tightness while closing, and this leads to white scar formation. If we are doing only FUE technique, if we try to harvest higher number of follicle units, we are under risk of such complication like donor area depletion. So combination of FUT and FUE gives us chance to harvest big number of grafts and saves our donor area of our patients. Of course, there is body hair transplantation. We can use beard hair as well. But when our target, or when our donor area is nape of the head, combination is only option to harvest higher number of grafts without white scar formation or without donor depletion.
And when you say advanced, I know obviously Norwood 7 would be the advanced. Are you also doing these cases in Norwood 6s, or is it really just exclusively 7s?
It depends. Some you can do in Norwood 5 if patient already did procedures, you have scarring in donor area. When patient has poor donor supply, when patient's donor area density is lower and flexibility, laxity of donor area is not good. So combination of FUT and FUE is for difficult cases, higher donors, higher classes of male patriarchal loss, and poor donor supply, and poor flexibility, laxity of the scalp. If patient has androgenic alopecia class 3, 4, even 5, find normal that his density is okay, you can do only FUE and only FUT. So why this torture? So combination is for difficult cases only.
Awesome. Konstantinos, I'm sure you have a very similar approach to or answer to that. Is there anything different to that answer you would like to
add? Generally, as time goes by, I'm changing my indications for when I use combo. So some years ago, I presented my algorithm on when to combine these two techniques, and I split it into different branches. So one is for medical reasons, and the other is for societal reasons. So, for example, for societal reasons is for patients who don't want to shave their donor area for professional or other reasons. And in this case, we might be considering strip surgery, FUT surgery, together with a limited long hair FUE. And medical reasons are, in that case, I was, and I'm still actually branching this decision between virgin donor areas and non-virgin donor areas. So there are actually plenty of combinations that one can use in my algorithm to decide whether to use the combined technique or not. However, my recent, let's say, addition in the approach is that the patient should have in mind the long-term effect of both techniques. And that even though I totally understand that some people might be very self-aware of cutting their hair on the donor area very short in order to have hair restoration surgery, the patient should keep in mind the long-term result. And in that case, I'm more and more inclined to believe that a very strategic FUE session will give, or several FUE, strategic FUE harvests will give better results compared to the similar amount of FUE of strip grafts. So, for example, if I harvest strategically, always 6,000 grafts from a donor area with FUE under 2 or 3 sessions, these grafts will give a better result than getting 6,000 grafts with strip surgery on a virgin scalp in 2 sessions. The result will be better with FUE for several reasons. We don't have any more FUE grafts to take from a donor area. We have exhausted. Okay, so my only indication at the moment to use strip or a combo technique is when the donor area is exhausted FUE-wise, but using strip, you can get a lot of more grafts and also take out a lot of scar with strip surgery and use FUE to get body hair. So I totally understand how Akaki is approaching it, and I used to do it also myself some years ago. So if some patient needed 5,000 grafts or 6,000 grafts, and he was flying in from another country, yes, I would combine strip surgery and FUE in one day, do 5,000 or 6,000 grafts, and the patient would be done. But, you know, experience comes to show you, in my case, the right way. And in that case, I totally prefer to pay the tickets for my patient to come back in a year and do another session for 3,000 grafts on my expenses, the tickets and accommodation, in order to ensure a better result. So I'm not doing any giga sessions anymore, even if the patient wants that, even if the patient's donor area can actually entertain a giga session of 6,000 grafts, and I'm splitting it to 2,500 or a maximum of 3,500 in 1 2-day session. And my results have been much better if I do not exceed this number of grafts per session or per 2-day session.
So I want to just clarify this with you. So you're saying that by not doing a large session of combination FUT, FUE, but doing a staged FUE, which is obviously not what this is specifically about, this masterclass, you're seeing better results. And when you mean better results, are you saying you're getting more growth, or what are you saying?
I'm getting more growth, more percentage of growth. I really believe I'm close to 100% of survival. And I'm getting more hairs per square centimeter, even if I had the same growth. So imagine if you're taking a strip, the grafts that you're using is what the strip is giving you. But when you go with FUE, you are cherry picking the grafts.
Yes.
So overall, there is no way that I will get the same number of hair per 1,000 grafts with strip as with FUE.
Makes sense.
Even so, my approach now, you know me for years now. You remember 10 years ago, 11 years ago, I made a presentation in a way against FUE. I have done, but now I have a 180 degrees turn, not because I was only wrong, but also because things improved a lot. We improved a lot the instrumentation of FUE. Then we minimized the wound with FUE, and we maximized also the survival of grafts with more exotic solutions and better understanding of FUE. So I don't think I was wrong 10 years ago, but I'm definitely sure I'm right now.
Konstantinos, go ahead. Sorry.
Yeah, so I believe that the strategy that I'm doing now, doing FUE on patients until I have no more grafts for FUE, and then doing strip combined possibly with body hair FUE is the strategy that I have seen to work best in every way.
It's a very interesting way. I think this is going to be a very interesting contrast between both of you. I would love to ask you about, to me, cherry picking sometimes causes donor depletion faster. But I think we're close to out of time. Akaki, the reason I have him at this masterclass is that he has an amazing idea of reducing the tension of the FUT incision through FUE with some mathematical understanding. That's a tease for you guys out there, so we're not going to go into that today. This is going to be an advanced session, which is going to go very deep and granular. And I love the evolution of Konstantinos, who's really a mastermind in thinking. And he's so honest in his approach, and he's just very transparent in thinking about this. And so even though this course is geared toward a combination FUE, FUT, he really has transitioned more to FUE, but he uses FUT in a different way than Akaki. And you guys are going to be the benefit of this. So again, we could spend hours talking about this. I feel like I've only scratched about 2% of the discussion, but you got to join us in Berlin, October 23rd through 25th for the series of master classes. So thank you, gentlemen. I appreciate your time today.
Thank you.
Thank you, Sam. We'll be happy to join you in Berlin.
See you in Berlin.